Hi nurses, welcome to Shift Change, the podcast for nurse leaders who are ready to shift their thinking from just a nurse to claim their position as a powerful agent for change. I'm your host, Amy Deagle, founder and CEO of the International Network of Nurse Leaders. We believe in the power of nurses to change the world, so let's get started.
Hi nurses, welcome back to another episode of the Shift Change podcast, or if you are just joining us for the first time, welcome. We are thrilled to have you here. I'm Amy Deagle, your host, and I am really excited to bring you a guest that is another interaction via Joanne Peterson. If you've been a longtime listener, you know that Joanne has been a guest on this podcast a couple times. She actually interviewed myself, and she has set me up with some of our incredible guests. So I'm always excited when a connection comes through Joanne because I know they are just going to be an incredible person to interview and pass on so much knowledge and advice to you. So I'm really excited to bring you this interview with Carolyn Hoffman today. But before I get to introducing Carolyn, I just wanted to take a moment and remind you of the I Am a Nurse Day happening April 8th, 2020 in Winnipeg, Manitoba. This is put on with the Association of Registered Nurses of Manitoba, and I will be there doing a keynote in the morning, and I really hope you can join us because it's so important to come together and as nurses to recognize the power and pride in what we are. Nurses are an incredibly important part of society, and in coming together, we get to find that collective power, our pride, and really tap into our leadership. And so I Am a Nurse Day is a collection of provoking, interactive conversations with nurse leaders and compelling Manitoba nursing professionals that will empower you as a nurse and inspire you to consider what is possible on your path forward. You don't have to be a member of the Association of Registered Nurses of Manitoba to attend, but if you are a member, you do get a discounted rate. And so if you're interested in coming to that day, just visit arnm.ca. And now it is my pleasure to introduce Carolyn Hoffman. Carolyn Hoffman is a registered nurse with a Bachelor of Science in Nursing and a Master's in Nursing, who has senior leadership experience in hospital operations, provincial government, nursing regulation, and quality improvement in healthcare, all with a focus on patient safety. She was most recently the executive director of the Saskatchewan Registered Nurses Association and was previously the SVP Quality of Healthcare Improvement for Alberta Health Services, the largest health region in the country. In 2004, Carolyn was one of the first employees of the Canadian Patient Safety Institute, where she was Director of Operations, Ontario to BC. Her key responsibilities included internal lead for the development and launch of the Safer Healthcare Now national campaign. Carolyn is co-author of the Tool for the Concise Analysis of Patient Safety Incidents, the Canadian Incident Analysis Framework, and the Canadian Patient Safety Dictionary. She is currently the president and CEO of the Institute of Safe Medication Practices Canada, ISMP Canada, a partner in the Canadian Medication Incident Reporting and Prevention System.
So hi everybody and welcome to the Shift Change podcast. I am so excited to have Carolyn here with us today. Carolyn, welcome to the Shift Change podcast.
Thank you, Amy. It's a pleasure to talk with you.
So we've just heard a bit about you and your, professional bio, but I would love to hear more about your nursing career and your journey into nursing and leadership and what it looks like today. So could you walk us through that story?
I would be pleased to. It's been a wonderful journey, and it's not over yet. I think I have many years of leadership in nursing to still be active, but it did start quite a while ago, back 40 years. And I started nursing by taking the diploma program in Regina. It was the Wascana Institute of Applied Arts and Sciences way back then, 1978. And graduated and just knew from the beginning that I would love it, and I was right. I started nursing on a surgery ward, general surgery, and really immediately found it daunting, as new graduates often do, but also rewarding. And I decided that I was going to invest in it and really this was my career and it worked out very well. I ended up moving to different types of general duty nursing roles, cardiac surgery, critical care unit, intensive care unit. But I found my true passion, I believe, with clinical nursing when I started working in the emergency department at the Pasco Hospital in Regina. What an amazing team. I had felt in different ways across my early practice years of being at the bedside that there's a big difference between some teams in healthcare. And sometimes I wasn't being heard. I wasn't being seen. I wasn't being heard with my nursing skills and abilities. And sometimes I was. And so I really noted that and felt that I would continue working in different areas and get my knowledge skills highly developed and build my confidence. And so over 10 years in the emergency department with an amazing nursing and interprofessional, interdisciplinary team. One day, the head nurse there at the time was called the head nurse, Helen Grimm, came to me, and she had known that I had a critical care background, and she said, "Would you like to teach cardiac monitoring to the staff?" And that was my first official tap on the shoulder to say, "You've had some skills and abilities, and would I like to move into a teaching role to do that?" And it was just one day away from my clinical duties, and but it was a very powerful day. I loved it. Oh my goodness, to be able to share and engage and help others to learn was so powerful. And it wasn't too long after that an educator job came up, lucky me, for the 3 emergency departments in Regina Health District. And I applied for it and got it and spent a few years really focused on developing a nursing orientation and policies, procedures, working with many in the health district at the time to advance emergency nursing. And it really began to open up my eyes, open up my perspective to the broader world of what needs to happen so that the nurses can do their job. And education's part of that, good, clear guidance with policies, procedures, a great leadership locally and at a district level and now a health region level and provincially at the ministry level and nationally. They all play a role in nurses being able to do what they need to for patients and families. And it opened my mind to more possibilities. And one thing that raised itself to me was a quality improvement risk manager role for Regina Health District. And I thought, can I do that? Wow, it was daunting, but I thought, you know what? I want to take on that challenge. And a nurse is perfect for that. A nurse has the kind of background that could bring, patient and family perspective, clinical perspective, but also this broader policy education perspective. And I moved into that. There were many great things about it, many challenging things about it. First of all, the great things. I got to work with teams in every area of healthcare to help them get ready for accreditation, to help them look at their local processes and improve them. But I also received all of the incident reports from all across the district. And when a bad thing happened, I would know about it. And I started to see that in my previous world, bad things seemed to happen rarely because they were happening once in a while. I only worked on 1 unit or 3 units, so I had a narrow window into the safety of our patients and families. And so I didn't realize it, but across the health system, bad things happen more often, and bad things happen when they shouldn't to patients and families. And a bad thing can look like a medication error, like a 10-fold insulin error. A bad thing can look like leaving a surgical instrument behind after surgery. A bad thing can be a client in a long-term care facility falling because something was left beyond reach and they couldn't reach it. And in the process, they ended up falling. Bad things can happen in many different ways. And I began to see how often it happened. And I worked with a lawyer that began to challenge me and say, Carolyn, what are you going to do? What's the district going to do to make sure that these bad things don't happen again? And from then on, I was embedded and believed so passionately about the system perspective to patient safety. And the system perspective is looking at what was around the direct care providers that made it easy or hard to do the right thing and to make sure that errors didn't happen. And it validates that individual providers like nurses, like physicians, pharmacists, all are accountable for their behavior. But if they're put into a system where they don't have the tools and the support and the recognition that they're humans and they're going to make errors, so what's there to help catch them and make safe decisions for patients or with patients and families? And so that perspective, that patient safety hat that I now had on tightly and embraced it and became passionate about it, have shaped literally every position that I've held since. And I've had the wonderful pleasure of holding a number of positions with nursing leadership. I was the executive director for critical care in a hospital in Edmonton, and I held a provincial role in terms of quality and patient safety for Alberta Health Services. And now, today, 40 years later, I'm the president and CEO of ISMP Canada, and I get to work with an amazing interprofessional, interdisciplinary team and advance medication safety as one of the most important aspects of patient safety all across Canada.
Such an amazing career and so many different roles within nursing, and I think that's just fantastic. So I wanted to learn more about the Institute of Safe Medication Practices, but before we dig into that piece, Carolyn, I'd like to go back to your educator role. So one of the great things about this podcast and talking to nurses like yourself who have had really varied career paths within nursing, I like to highlight some of these other roles that maybe nurses don't know are available to them. So I just want to kind of go back through some of those roles that you held and really get a sense for what that looks like, what if a nurse is interested in that, kind of the steps they could take to get into that sort of area, and, some of the best pieces about those roles. So let's talk the educator role.
All right. Well, that's a great place to start. There is a number of different strategies I can think of in terms of getting into those roles. For myself, let's start there. I did begin pursuing a degree. By the time I moved into the educator role, I obviously finished my diploma, graduated, was taking courses like advanced cardiac life support, etc. But I started taking classes to get my degree in nursing and finished that. And that was one part or one aspect to the educator door opening for me, was to have the education that was needed to do that. So I got that. I also had the attitude that I was an informal teacher with my colleagues. I demonstrated the behavior that I wanted to support my colleagues, and if they had any questions, informally, side by side with them, delivering patient care, they knew they could count on me for that, or I believe I was transmitting that. And I also did my homework for the posting, for understanding what would be required, and for the detailed knowledge that would be needed for emergency nursing. And so I became certified as an emergency nurse with the Canadian Nurses Association back then. And a combination of all of those things helped that educator door to open for me. I think that it's still good advice, those aspects, and really having the confidence when you see a position like that. If you've done your homework, you've got the educational requirements, have you also done extra things in your clinical days, in your approach with colleagues, in your dialogue with your managers, etc., that indicate to them that you want this challenge, that you actually have the skills and abilities for it.
I love that. And I love the piece of advice you said where you were already showing up as an informal educator, just within your peer group. And I was just talking to nurses the other day, and they were looking, they want to get into leadership. And I said, well, you don't need to wait for the official title or an official job. Like, start that today or your next shift, and start being the person that people can come to, and start being that influence within your peer group, and start, calling out people for the great things you see about them, and start appreciating your colleagues, and start building that culture of appreciation and recognition today in your current role, because that's part of leadership. So I love that you mentioned that with the education piece, that, you started with where you were at and grew from there.
Well said very much. Leadership is a value that you have, a behavior. Every nurse, in my mind anyway, needs to demonstrate leadership, no matter what you're doing. And there's many different aspects to it, but it should be part of every day for nurses.
Yeah, I agree. So with the quality improvement risk management role, that's definitely one that is a little bit outside the box as far as nurses when they're picking career trajectories. Can you tell us a bit about the skills that you need for that type of role, and just kind of what a day-to-day looks like in that type of environment?
Well, there is a variation to it. I believe nurses are positioned beautifully for that role for a number of different reasons, but other types of professionals do that role as well. Mm-hmm. I think it's about having the educational requirements, and so that's a degree for sure, and it could be a master level as well. So thinking through if your interest is in growing in that area, what kind of education do you want to be undertaking to position you best for that? And during the time that I was in that role, I started taking my master's program. It also is a role where you have to have knowledge about clinical processes, clinical procedures. You have to be able to interact with a wide variety of staff, patients, families, ministry officials, sometimes lawyers, insurers. And so you have to be, but I think most nurses are, very flexible, very confident, and very clear in your communication and in your ability to engage, truly engage, hear people, seek to understand before you try to share anything that should be done, and then work with whoever it is you're talking with to understand their perspective and what needs to happen for the best outcome for all involved. And so every day was unique. Every day was very interesting, very much part of what I would look forward to is not knowing today what was going to come up, but being able to respond to it in a clear, empathetic, but also factual and effective way for quality care and patient safety. So, for example, a classic thing would be a major error occurs somewhere in the system, and the response is important to respond quickly, to make sure that patient is okay, family is okay, providers are okay, any risk to anyone else, no, okay, that's been dealt with. Now what do we need to collect? How do we effectively analyze what happened to bring system improvements that will meaningfully help everyone involved to have safe care? And so it turned out my passion in that area led to me developing incident analysis methodology for implementation in Regina Health District. And that was a wonderful way to open up many other doors, because at that time, it was very early in Canada in terms of not just blaming the provider involved. So historically, in my early career days, if you made a medication error, if you made any kind of major clinical error, you were to blame. It was naming, blaming, and sometimes shaming approach. And it is very, very rare. Unfortunately, it does happen, but it is very, very rare that a provider is actually intentionally or unintentionally incompetent and is causing patient safety risk from a way of lack of due diligence or lack of trying to. We know that nurses come to work every day to do the best they can. And most of the time, again, I say sometimes it does happen that unfortunately we have abuse or even intentional harm happening. But the vast majority of times, this is unintentional. This is a wonderful nurse that has made an accident and they're human. So how does the system learn from that to make sure it doesn't happen again? So I'm very pleased to be one of the co-authors of the Canadian Incident Analysis Framework, and that early work dates back to my time in this role.
That's incredible. So can you tell us how the Institute of Safe Medication Practices, how you got into that role and what that looks like in the work that is done there?
The Institute for Safe Medication Practices Canada is a national, not-for-profit, independent organization with a focus on medication safety. And that focus is on gathering reports of where a bad thing happened, analyzing them, working with system partners to design effective system strategies that, if implemented, will reduce the risk to future patients. And we do that through many different ways. I'm very pleased to tell you that we have 3 streams of reporting right to ISMP Canada. One is individual practitioner reporting. So any practitioner that wants to report, it could be a medication incident, that's what we collect. So any practitioner that feels strongly about an incident can anonymously or with identification submit a report to us. Also, we take consumer medication incident reports. So any consumer can report an incident to us. And we also have community pharmacy reporting to us. We use all of that information to inform our work. We also search or query and analyze incident data from the Canadian Institute for Health Information. They have 2 sources of incident data, hospitals and long-term care incident reports. So together with this real knowledge of what's going wrong, we use that source, but we also use our partner collaborations to know what's going wrong as well. And almost any healthcare organization you can think of in Canada, we've either worked with them or we're working with them now. We're so well engaged and tapped into this wonderful pan-Canadian mix of the Canadian Patient Safety Institute, Accreditation Canada, but also hospitals, health regions, ministries, regulators, associations. We literally connect, and they often will share with us, including Health Canada, they often will share with us when a bad thing has happened or when a bad thing might happen. And we work together to analyze that and come up with effective strategies to reduce the risk. So we share that through our bulletins, and if people listening are not receiving our bulletins, they're free, and you can go to our website and sign up for them at ismpcanada.org, and you can get that news bulletin right into your inbox that has really understandable information. That's one of the things we focus on is making it so that anyone can read it and understand it. And if it applies to your clinical setting, or if you're a consumer on that medication, you can take action to reduce the risk. And so we do use that as a major mechanism. We also teach in-person workshops. We have online educational materials, and we're always looking for ways to partner with organizations to help them individually when they need it as well.
What an incredible organization. And for anybody listening that is interested in learning more, we will make sure that the Institute of Safe Medication Practices website is linked in the show notes and also available on our website under Carolyn's episode as well. So if you're looking for the information, we'll make sure it's easy for you to get at. But thank you for explaining everything that they that the organization does. That's incredible.
Nurses, it's time for us to recognize the power and take pride in what we are, nurses. On April 8th, 2020, find your position of power, pride, and leadership by joining your community of nurses for I Am a Nurse Day, a collection of provoking, interactive conversations with nurse leaders and compelling Manitoba nursing professionals that will empower you as a nurse and inspire you to consider what is possible on your path forward. We need to eliminate the just a nurse mentality and replace it proudly with I am a nurse. This day will reconnect you with your why. This day is designed to reconnect you with your why you decided to become a nurse in the first place, and to rekindle your pride and your commitment to our chosen profession. This day will remind you that the design of your own unique nursing career is up to you. And this day will elevate your idea of what is possible within the industry and inspire you to start putting your big ideas out there. It's time for us to lead the profession into the future stronger and healthier than ever before. I am so excited to announce that I am going to be a keynote speaker at the I Am a Nurse Day in Winnipeg, Manitoba on April 8th, and I'm really hoping that you can join us. If you go to arnm.ca, you can find all of the information there to register. You don't have to be a member of the Association of Registered Nurses of Manitoba to attend. Anybody can come. There are non-member rates. But if you are a member, please act fast because there is an amazing early bird discount rate that you can get in on. And if you are located outside of Winnipeg, but you still want to participate in this day, you can consider hosting an I Am a Nurse Day satellite site. And if you're interested in this option, you can find all the information on how to connect with the ARNM on their website. So again, April 8th, 2020, I Am a Nurse Day. I'm so excited to be there keynoting, and I hope to meet you if you are able to attend. And again, just visit arnm.ca for all the details.
So, Carolyn, I just am curious, because you've had quite a career that has evolved into different roles and heavily focused in leadership. How important is it for you to have a support network of people to champion you through your leadership journey? So that can be mentors, that can be communities of practice groups, specialty groups. How important is it to have that group of champions to bounce things off of and to just help you along your journey?
It's absolutely essential. Absolutely essential. The first people that come to mind are family, my mother and father, Edna and Clayton, my daughters, Sarah and Claire, and my sister, who was a registered nurse as well, Elaine. She's no longer with us, but she was a big part of my support network, and the family that is here today is still that major support, and they are almost like team members, I think, for all of us is family. And so that's where I start. I moved to nursing leaders that absolutely inspired me. Helen Grimm with that first tap on my shoulder, helping me recognize and realize and take action to explore a new possibility and support me through that. You know, those nursing leaders with a look, with a word, with a pat on the shoulder, oh my goodness, it makes your day, it helps you get through those difficult times. And I'm so pleased to share that I have had that throughout my 40 years. And now I remember that and try and walk the talk, try and do that, because I know for students and for new graduates and for those that have been working for many years, that type of I'm here, I hear you, I think you can do it, and you're important to the healthcare system is absolutely essential. And so, I think of people like Glenda that supported me in my operational senior roles. I think of the team around me today with Sylvia, who's a pharmacist, Mike, who's a physician, Julie, a pharmacist, and the nurses on our team here. They all work together and we help each other. And we wouldn't be able to do the work we do without that teamwork. And in fact, in the literature of the last 5 years or so, it's showing and validating that as individuals, our behavior is so important, our accountability. But one of the most important aspects for patient safety is how well you talk to each other, how well you hear each other as a team, and how well you help each other in doing the right thing. And literally the governance of the organization is a big piece of that support and team. Those that work beside you, absolutely, as well, but your managers, your directors, your vice presidents, your CEOs, and your board, how well does the team listen to each other? How well is the team supporting, especially supporting those that are on the sharp end of care, that are there at 2:00 in the morning, and either they have what they need or they don't. And you just want to make sure that they have what they need as a leader.
Yeah. So I love that. And I want to just dive in a little bit. Any advice or suggestions that you would give to nurse managers, so those in official leadership management roles, but also nurses who are identifying as leaders within their units, whether they have an official title or not, that are really interested in looking to improve team culture and dynamic in their workplace? You've mentioned it a couple times now, the importance of a well-functioning team to avoid errors or bad things happening. Do you have any suggestions on if somebody's looking to improve that dynamic, how they would go about doing it?
I do, of course. And I think I would start with the philosophy, the belief, and the action of asking questions. Mm-hmm. Asking questions may be the single most important thing I do every day. And if I see something and I think, wow, why is that happening? Ask why. Ask why. If I feel something and I feel concerned about it and I want to work it through, ask for help, ask for dialogue, ask for discussion and some resolution to what you're feeling. If you see a patient, or like we all did in clinical days and many of the nurse leaders at the bedside, when you see your patient, every patient, what's the most important thing they need that day from you as a nurse? And if you haven't asked yourself that, start asking that. Start asking about what your patient needs, what you need, what your team needs. So a manager, hearing those questions, hearing that dialogue, encouraging that dialogue is taking step one, is taking the first step to, well, we're going to be a good team because we ask questions, we're open to questions, and we want to find the answers together. And we all know those leaders that say, hey, that's a great question. Let's sort that out together. That message, you can't fake it. Either you can do it or you can't. And if you can't be confident and say it with confidence, let's figure this out together. Work on that skill, because literally individuals in the teams don't have all the answers, but the team does.
Right.
And you have to be willing to figure that out together. And so I think asking questions, managers encouraging that, and managers asking what's getting in the way of the team doing what they need to safely. Mm-hmm. What's getting in the way of the team doing what they need to safely, effectively, efficiently? Healthcare has so many areas where that's not happening. The Canadian Patient Safety Institute has said that errors and medical incidents are the third leading cause of death in Canada. The third leading cause of death. It's staggering to think about how many times something happened and it could have been different. It could have been safer. It could have been more effective. So I think that question and asking the team and then being ready to hear their answers and work with them to resolve it is so essential.
I love it. That is such a great answer. So you've mentioned a couple times about, you were tapped on the shoulder to kind of go into that education role. And I've heard from several of the guests on the Shift Change podcast that they had also been tapped for these kind of leadership roles. What advice would you have for somebody who is feeling called to leadership but isn't being tapped? Because there's several of us out there that feel, like we haven't got that encouragement, that we've been told to kind of tone down and wait for our time. So what would you tell somebody who is really feeling called towards that, but maybe hasn't found that support within their work environment to feel like they could maybe make that move?
What a great question. Because literally every nurse is a leader. Every nurse could move into leadership roles. So what would be the reason why they aren't getting tapped on the shoulder? And I'm thinking of strategies like asking why not. Does the nurse feel comfortable with approaching colleagues, approaching their manager, approaching, really anyone that might know them, and be able to give advice back about why not? Why isn't that happening? And being ready to hear, asking for it authentically and being ready to hear what you hear back. And then taking the steps to address that gap. So it might be anything that we've talked about already today. Like it might be not having the education that is required for a certain role. It might be, not demonstrating the leadership role, the leadership capacities, the skills and abilities in your day-to-day work. It might be that some other interprofessional or or communication-related aspect is getting in the way of that. And what better than to know what someone might say back? The other thing that I think is really, really important is I can tell you that I worked in places where I wasn't tapped for leadership for whatever reason. And I said, okay, not now, but I'm going to continue and pursue and develop my skills and abilities. And I might move around. I might move to a different location or a different job to see what kind of new opportunities present themselves. So I think it's really looking at your circumstances, asking, like I've reinforced with questions, and then also having the confidence to say, but I'm on that track. Who can I reach out to? Where can I reach out to get some help in another way with my leadership journey?
I love that. Thank you. And I just want to take that one step further too. If you're listening to this podcast and you're feeling like you want to be moving into official leadership titles and roles, and nobody is, tapping you on the shoulder, it could be as simple as they don't know you're interested. So you need to have those conversations and let your managers and, your peers know that you are interested in developing those skills. I love the point about asking questions and getting the feedback and putting yourself in the driver's seat. You are the one that controls your career. So, moving to a different workplace, challenging yourself in other ways, getting education. But really, if you're feeling that call to leadership in a more official capacity, then absolutely you should be pursuing it. And there's so many ways to go about that. So thank you for that answer, Carolyn. So I would love to know what you think is one of the biggest challenges facing nurses today and how we might go about solving that challenge.
Well, of course, it's the $1 million question, and we all have our different perspectives on it. First of all, I would just say, I think what is most important about the nursing profession and where we are today and where we want to go is to have groups and organizations like the International Network of Nurse Leaders, like other nursing groups, right, that get together, that provide a forum, provide a way to connect and dialogue and plan together for the future. That could be the Canadian Nurses Association. It could be the provincial associations and regulators. It could be your health region providing that kind of professional opportunity for dialogue and shaping the future of a profession. So I think that to boil down to an answer that I'll share today might be interesting and helpful, but that broader dialogue and direction and engagement by nurses, for nurses, is so important, not to the exclusion of the team because of what I've said about how important the team is, but because it's so important. Nurses are the largest number of health providers in Canada. Where are we today? Where do we want to go? If we don't plan it, somebody else will. Somebody else is going to do that. So, and of course, we need to do it with partners, but we need a real voice in that. And so I would encourage that. I would think one of the biggest challenges from what I have seen is wonderful graduates are coming out of amazing programs across Canada. I've had the pleasure of working with programs in Saskatchewan and Alberta that are, and now Ontario. I just finished having a practicum with the Master of Nursing program student out of Ryerson. So I can tell you all across Canada, great programs. We're graduating these nurses, and many of them are coming into workplaces where their voice is not valued, where their opinion is not fully engaged, where they're not a full, recognized, valid partner in the care team. And there's a wide number of reasons why that might be, but in the end, that is very hard on career satisfaction, on workplace health, to be in a dynamic like that or feel that you're in a dynamic like that. And we are losing many nurses too quickly in their career. And sometimes the reason is the workplace. And so I'll say that that's such an important, many reasons, but one would be, what about the voice of the nurse locally? Now, that depends on the employer, the leadership, the governance, but it also depends equally on the graduates and on the nurses and on our peers, on the unit, in the office, wherever we work. What is it that we're doing with each other to demonstrate that as well? And what questions are we asking? And what are we spending time on so that we are a valued voice in the care team as well?
I love that. And I think you're so right. And, one of the challenges is we've been so good as a profession of, doing more with less and really advocating for our patients and putting patients at the center. But we haven't come together and really advocated for ourselves and each other on some of these workplace issues. And, we're getting new grads coming in and they're leaving the profession quicker than ever. And I think the stats were like within 3 to 5 years, they're leaving the profession. And so one of the pieces with the International Network of Nurse Leaders is really this coaching piece that I offer about finding your fit in nursing. And I feel like that wasn't a conversation when I first graduated about, there was a lot of units that staffed kind of at that 2 feet in a heartbeat mentality where if you were a nurse, you were a nurse, you were a nurse, and they just plugged you in. But it's really about doing that self-reflection piece, which is part of leadership, and knowing yourself and where your strengths lie and your personality and just the impact you want to make, and then finding your right fit within the profession. So just because you graduated into something and this is your first job and you're, not finding the enjoyment and the satisfaction out of it and you're stressed out and it's, you feel like you're not making the impact you want to, that doesn't mean you have to leave the entire profession. It's just where else can you move your career? And you're a great example of that into those different roles, that you took on, that there's so many options out there. And I just don't think nurses know enough about the other trajectories they can take within the profession.
I agree fully. And I think back to the day that I was the executive director of critical care at the ALEC in Edmonton. And we like every other unit had high turnover, and one of the things we did was we asked why. Donelda, the program manager for that area, and myself, we were authentic in wanting to know why. And Donelda is an absolute amazing nursing leader and clinician combined, and she and I were open to what the response was going to be, but more importantly, sometimes there's a solution to that response, and sometimes there isn't. Mm-hmm. For example, one of the reasons we heard was, we wanted to learn critical care. Now we want to go learn another area. Mm-hmm. And you go, well, that's a good reason. Okay. But knowing why is so important, and where you can do something with schedules, which was another thing that was raised as an area where we might be able to keep more if we made some scheduling changes, where there is things that you can do for workplace health and work-life balance, we absolutely have to, and hopefully individuals are going to have that discussion. It would be so important to me then and now, for example, with my current team members, if someone was leaving and there was something I could do perhaps to work with them, I would want to try. So do ask those questions if there's a support or a dialogue that you can have. But if that doesn't work out, absolutely, there are so many opportunities that are amazing out there. Explore them, for sure.
I love that. So as a leader in the nursing profession, Carolyn, what change do you hope to impact, or what would you like your legacy to be when you look back on the end of your career? And I know you said you have many years left, so this will be a future experiment, but what do you hope when you're done and you're looking back? What do you hope that legacy is?
Well, definitely related to my career, because I'll have different legacies for my family, obviously, but related to my career, I would hope that they say Carolyn actually helped to reduce needless harm and death in our Canadian healthcare system. She meaningfully engaged and helped others to meaningfully engage patients and families and nurses and pharmacists and physicians and every other group or organization that should be engaged on this journey. She made a difference with doing that and getting that collaboration. And in the end, at least one patient, if not hopefully many more than that, did not have to have an adverse event or an error, did not have to experience pain needlessly, disability, or, in many cases, death. And if they say that at the end of my career, that I had a small piece in reducing that in the healthcare system, that's my legacy, and I would be so pleased with it.
That's incredible. Thank you for sharing that. And I really just want to take a moment and appreciate the work you are doing with the ISMP and just, in general, your career. So thank you for being such a great nurse leader in our profession.
Well, thank you.
So, Nursing Now 2020's mandate is to help raise the profile and status of nurses, and the WHO has declared 2020 Year of the Nurse and the Midwife. Even though we consistently rank as the most trusted profession, we're definitely not the most influential profession in healthcare. So, Carolyn, what do you think we can do to help achieve this mandate of raising the profile and status of nurses, and also increase our influence in terms of policy and decision making?
I think one of the most important things we can do to raise that credibility, raise that influence, is first of all to make it an objective in our day-to-day work, and also think, how else can I move this forward? So I can do it today with the patient that's in front of me. I can talk with them about why I'm doing what I'm doing, can I help them, what they might need. I can actually demonstrate how influential one nurse or team can be to the patient, and then they leave knowing that and carry that with them for the rest of their life, really, when they feel that kind of caring and collaboration and support. So that's so important. Do that today, do that tomorrow, but also raise your head a little bit, look out and say, who can I connect with around me to bring this influence to more people, to political aspects, to organizational decisions, to boards. There's many, many different areas where this influence, this voice is so important, not to the exclusion of others, but because it is a voice that must be heard, and our opinion and our knowledge and our skills are so important to what the healthcare team can do effectively. So think about who and what organizations you can connect with to help bring that kind of, well, resources really. When we think about joining an association or going to an association meeting or joining the International Network of Nurse Leaders or joining or forming a group at your hospital or your clinic or your long-term care facility, what kind of mobilization can you activate? And many times, I can't do that, but I would challenge, and I know you would too, but let's challenge for some kind of step to bring that voice forward. And it could look at many different ways. There's lots of different options out there, but let's do it. Let's actually just say this year we're going to actually take a step about influencing not only those patients and clients and residents and families in front of me, but the bigger system. And then we get to really bring this 2020 mandate to life.
I love that. And it's so many people can get stuck in the fear and the self-doubt piece of, speaking up or taking that risk of moving things forward. But you're never going to know unless you try. And the best antidote to fear is action and actually proving to yourself that you can, achieve those things or speak up and move your career forward and have your voice heard and collaborate with others. So I love that. Thank you for sharing that. So Carolyn, what are some things that you see happening today that make you really proud to be a nurse and really proud of where our profession is heading?
Well, there's many things, and I'm such a proud nurse every day. I'm on Twitter, so I see many examples in social media of the voice of nursing, and that's one way we can help with the advancement of the credibility, with the opinion, with the voice of nursing. I give a shout out to Joanne Peterson here. She's former president of the Saskatchewan Registered Nurses Association. She's on Twitter often, bringing wonderful perspective to what's happening today that in many ways has been influenced by or could be influenced by nurses and the positive impact on patients. But she's also a great team player. She highlights others on the team and other organizations, not just nurses. So she's bringing both perspectives. That's one example that I see, and I'm so proud to say I know her, or she'll bring a tweet forward where I can now know a new person like Amy, yeah. or many others in the nursing world through that mechanism. So that would be one example that I see daily. In my other day-to-day work, I see examples of where nurses have shared that a bad thing has happened, whatever that is, an error, maybe a set of circumstances that have resulted in a medication incident. And they've stepped up, they've shared it, and then they want to know, what can we do to make sure it doesn't happen again? And that happens thousands of times a year for ISMP Canada. We get that many reports from nurses, or reports that were discovered by nurses. And I'm so proud of that nurses would do that and do that. So that would be another great example.
That's amazing. And I just want to touch on, connecting. I feel like there's this movement on social media for nurses to connect with each other, and we're seeing it more and more. The entire Shift Change podcast would not be here if not for a Twitter connection that I made with Joanne Peterson, and that spurred the whole thing, and she was on the podcast twice as a guest, and then actually as a third time she interviewed me. And so if you're interested in the story of how the Shift Change podcast came to be, you can actually check out the episode where Joanne interviews me, because we touch on that. And it just shows the power of connection, and that nurses are looking to make those connections with each other outside of their work environments at that higher level to have those discussions. And Joanne's Twitter is definitely a great resource for nurses, and I'm so glad that she connected us as well, Carolyn.
I am too, and what a great example to share of what can happen when you open up and, connect with someone.
Yes, I agree. And we are nearing the end already. This went by so fast. So, Carolyn, I was just wondering, can you provide our listeners with 3 tangible takeaways or pieces of advice?
I do have 3 that I can think of, and they're probably not going to surprise you. I'm going to circle back to some points that I raised earlier, but that's how strongly I feel about them. The first one is for nurses to ask questions. It's so important. It's so important. It's so easy to get into a day-to-day rhythm, a day-to-day approach where it's just doing what you're doing. But please, one thing that I think is so important for all nurses and nurses that are leaders and want to advance their leadership is to ask questions. The second one would be to believe in yourself. And you mentioned it as well. So it's not a new piece of advice, but I think it is absolutely essential that you have knowledge of self. You've self-reflected. We have to do that every year. Mm-hmm. It's a regulated profession. So you've self-reflected. You've got some advice from others. You've looked to the literature. You're doing it in a meaningful way. You're always trying to make sure you have what you need to do your job safely, effectively, efficiently. So given all of that, have confidence in yourself. You have very specialized expertise. You have the patient, family, client, resident in your heart, in your mind. It is an art and a science. So you're bringing both of those aspects and take them forward with confidence. The third goes back to what I have learned so much about over the last 40 years, and that is the authentic and complete full engagement partnership with patient, client, residents, and their families. I can tell you from my early career, I felt I was in a system and had education to tell patients and families what they needed to do, not in a bad way, not in a negative way, but here, do this, this, and this. And it was from a pure heart, from a good heart. But we now know that that's not the way patients, clients, residents, and families learn effectively. They learn when you say, what is the most important thing for you today? How do you safely go home with what you need for yourself? These are all these questions that are so important. And by opening that door and then truly listening to the answer and then partnering to come to resolution and achieve that, we're going to get a safe healthcare system.
I love that. Thank you for sharing. So, Carolyn, we're going to make sure that people can connect with you on Twitter, and we'll link the ISMP website as well in the show notes and on our website under your episode. Do you want to just tell them what your Twitter handle is as well, if anybody's listening and wants to plug that in right away?
Sure. It's at Carolyn, ISMPC.
Perfect. All right. So I just want to take a minute and just thank you for being here. I appreciate your advice and your generosity with your time. And just thank you very much for being here with us today.
Well, I would like to thank you for your leadership in doing the podcast, in the network, advancing the network. And I would be pleased if anyone wants to reach out on Twitter or other ways to follow up to advance nursing leadership. I believe in it so passionately, and I thank you for doing the same.
Thank you. All right. So in closing, Carolyn, I would ask you to share a story from your nursing career that's had an impact on you.
There's so many stories, and when I think about them, I get a little emotional. But the one that comes to mind maybe is the best way to end. I was working in the critical care unit many years ago, and a gentleman came in with an acute MI, or myocardial infarction, and I was one-to-one nursing with him through the night. I was on the night shift, and he was critically ill, and I was in there and out very often, worried about whether he would make it through the night because he was so unstable. And using my therapeutic touch, using my voice, using my assessment and communication skills, doing all those things that nurse leaders do for patients and populations. And in the morning, at finishing up, emptying the catheter bag like we all do at the end of shift change, and cleaning my area quietly. He's resting, and he turned to me and said, and thanked me for being with him through the night, that it helped him. He felt better. He knew he was being cared for. He felt safe. And he grabbed my hand and just held it for a moment to say how much it had meant to him. That is one of the best ways I can say that I knew nursing was the right profession and that I'm doing the right thing.
Amazing. And the impact and the potential we have to impact patients' lives is truly an honor and a gift and a privilege. So thank you for sharing that story, and thank you for being here with us today. Like I mentioned, if you're interested in connecting with Carolyn, we'll have everything listed in the show notes and as well on the website under Carolyn's episode. So thank you very much again for being here. I truly appreciate your time.
Thank you, Amy.
Bye, everybody. Have a good day.
Hi, nurses. I hope you enjoyed that episode of the Shift Change podcast. I want to take a moment and talk to you about something really important that's happening this year. As you probably know, World Health Organization designated 2020 as Year of the Nurse and Midwife. And while it's important to celebrate the nurses and participate in all these events that are happening, we need to make sure that we are being strategic about making this the year that we really use our collective voice to raise the profile and status of nurses and advance our profession. Understandably, some of you may feel resistance to this call to action. After all, how can we expect nurses to raise the profile and status of nurses and advance the profession when oftentimes nurses aren't even getting a proper break to sit down, eat something, or even use the bathroom on their shift? But you know what? If we don't act and act now, nothing will ever change. No one is coming to save the nursing profession from the burnout and exhaustion, from the staffing crises and nursing shortage, from the violence and bullying, from the budget cuts, and all the other threats to our profession that we are currently facing. Only we can save ourselves. And that can only happen when we decide enough is enough. We must decide that this is the year that we are going to use our collective voice to shout our value to the world, to introduce innovative and revolutionary ideas into healthcare, to advocate for our patients and our profession, to shed the just a nurse mentality and claim our position as leaders, and in doing so, change our profession. This year, 2020, Year of the Nurse and the Midwife, you get to decide. Is this the year that everything changes? Is this the year that we finally say enough is enough and break through the status quo? Is this the year that you, yes, each one of you, decide that you are tired of just complaining and actually put in the work to make a change? Because the truth is, it is up to us. And nothing changes if no one changes. Let me say that again. Nothing changes if no one changes. There is a movement happening, and it needs you. We are stronger together. Come join us as we disrupt the status quo and evolve our profession. It's time. It's our time. We're stronger together, so let's get started. If you want to know how you can join the movement of change, visit nurseleaders.ca/2020nurse to opt in for a free 3-part video series about how we can use 2020, the Year of the Nurse and Midwife, as the year we use our collective voice and lead our profession forward. So jump on over to nurseleaders.ca/2020nurse for all the details. I'll see you over there.